Hello, in this slideshow, I'm going to share with you some exam writing tips. Now, this is for when you're actually in the exam and you are giving your answers. These are based on my own experiences as an exam taker, as well as my experiences as an examiner. So I'll start off with this quite funny quote that I found on the net. Let's hope that doesn't happen to you. Now, I'm going to organize this in terms of questions and then answers. So for questions, we'll look first at reading questions and interpreting questions. And then for answers, we'll look at where to start, where to stop, meaning how much to write, and then how to organize your answers. So let's start off by looking at questions. For reading, we're going to look at 3 steps, and then for interpreting, 2 steps. So for reading questions, the first step is that you want to always read the question at least twice, or if possible, until your palpitations stop. You want to underline the keywords as far as possible. Let me give you an example. The question is, what are 2 common causes of XYZ? Now, the key word here is actually common, because we're not asking you for rare things or esoteric things that are on page, 2005 of a textbook. We're asking you for common things. So give the commonest causes as asked. This will give you the full marks. Don't bother with the esoteric answers. You will definitely lose marks for this, so you will be given less than the full mark. Another example, describe the gross and microscopic morphologic features. Here, 2 keywords, gross and microscopic. Make sure you do not leave out one half of the question by just giving the gross or just giving microscopic. You are being asked for both. So here is an important tip. Do not over-interpret or try to second-guess the examiner's intent. Your first impression that after you read the question is usually correct. Examiners do try to word questions as clearly as possible for you. Now, step 2. Read the whole question first. Read all the parts, especially if it's a multi-part question like an MEQ. On paper exams, this is very easy because the paper is in front of you. Unfortunately, though, if it's an e-exam, you will have to navigate through all the question parts first. So move from question part A all the way to part E or part F before you go back and start to answer it. Why? This is to save you time and energy. Quite often, students tend to over-answer the earlier parts, and then they realize that actually what they're answering is asked later on. And then they have to write the answer all over again when the question is asked. And often, the answer may not be actually as good as the original answer. So we can only give you X number of marks allocated to each part of the question. So make sure that you read the whole question properly, save your energy, and answer the correct answers according to the correct question parts. And step 3, look at the marks allocated. Now this does seem like a no-brainer, but I'm actually still quite surprised at how sometimes students give 1 or 2 word answers when there are many marks that are allocated. This is very important. The number of marks allocated actually gives you a good gauge as to how much you should write and how long your answer should be. You also want to look at the wording or the phraseology of the question to gauge how long your answer should be, and I will cover this later. So another tip, if the first question that you're reading is very, very hard, please don't panic. Move on to the next question first. Save time, start answering that, and later on come back to the first difficult question. Right, now we've looked at reading of questions. Now we're going to talk about interpreting questions. And here I want to share with you 2 things that you can do. The first thing is to understand the commonly used terms. We have a collection of past questions in the library which you can access. Now, some of the questions that are worded to expect short answers will be like name this and that, list, X number of items, state this and that. Okay, occasionally state may require a little bit longer answer, but you need to read the question proper to see what it means. Longer answers are generally expected for wordings like describe, how does this lead to this, how does this disease occur, explain something or other, and discuss, and also outline. Now for outline, we usually do expect some form of explanation, but not a very lengthy one. Now, you also want to pay attention. The second point is what is the question actually asking? So familiarize yourselves with these terms. You can listen to your lectures carefully, look at your lecture notes. Pathogenesis, for example, if we're asking you in a pathology question, what we want to know is the inciting event and the sequence of events or abnormal pathologic processes that then lead to the disease. Clinical manifestations, generally we're asking for signs and symptoms. What is the diagnosis? We want you to simply state the diagnosis. We don't want the mechanism or the pathologic process. For example, inflammation is not a diagnosis, it is a pathological process. We don't want the description, we simply want the diagnosis. Like acute appendicitis, that is a diagnosis. Right, let's move on to answers now, and we're going to look at where to start, where to stop, meaning how much to write, and how to organize answers. So where to start? Very important point, always spend a little bit of time thinking about your answer. Think about what this question is asking. So again, you have to really be familiar with the terms that are used in the question. Plan your answer. This of course goes for essay type questions. You want to spend 1 or 2, perhaps 2 to 3 minutes doing a rough outline. State your headings and your subheadings so that you know that you won't miss things out. This ensures you won't have any major points that are lacking in your answer. It also helps you to pace your answer, because as you are doing your answer, you can keep an eye on the time. You can go back, look at your plan and see how much more you have to go. So this is an important tip. The additional 2 to 3 minutes that you spend thinking and planning your answer are well worth it. They are often the difference between an okay answer and an extremely good answer. Now, where do you stop? Or in other words, how much to write? Well, the important clues to the length of the answer, of course, would be in the wording of the question. For example, short answer for name or list versus long answer for describe, discuss, etc. Again, I have also mentioned this, the mark allocation. These two together should give you all the information that you need about how long your answer should be. Now, if the question asks for 2 points, there is really not much point giving 5 or 6. What happens is that the examiners will look at the first 2 and ignore the other points. So the other thing is, you want to write as different points as possible. Try not to give variations of the same point, because this may lose you marks. For example, if you're asked to name 2 imaging modalities, you really don't want to say ultrasound as number 1 and Doppler ultrasound as number 2. This is not ideal. Make your answers vary. So ultrasound, number 1, and number 2, CT scan. Or, of course, depending on the right answer. Now, you want to stay relevant. Do not go off point. This is an error that a lot of students make. You will not get marks for length alone. In fact, it's a lot harder for the tutor to navigate a very lengthy answer. Now, how do you stay relevant? Keep reading the question as you answer it if you're not sure. Also, go back to your original plan, the one that you spent 2 to 3 minutes writing out, and make sure that you are answering according to that plan. Now, the third section, how do you organize your answers? Well, of course, this applies more to essay or MEQ questions. Point form is usually acceptable. In fact, it's a lot easier to read. Although sometimes tutors will explicitly discourage this, or certain disciplines, for example in ethics, I think it would be very difficult to answer a question in point form. So you can generally do answers in point form unless they are explicitly discouraged. Try to answer in sections with headings so that it's easier for the examiner to read, and also so that you won't keep repeating yourself over and over again in different places. Highlight the key points if your answer is long. Now, you can actually also answer well even if it's a short answer question. For example, name the diagnosis. You want to make sure that you give the full name. If it is a 3-word name, give all 3 words. First name, middle name, last name. Spell it out properly rather than giving abbreviations. Don't omit words. For example, if the answer is acute myocardial infarction, this is what your full marks will get you. 2 out of 2 marks. If you give an answer like myocardial infarction, we're not sure that you really know it's acute, what if you actually thought it was a healed myocardial infarction or an old myocardial infarction? Or even worse, if you just give us abbreviations, we're not sure that you actually know what these abbreviations stand for. So you will not get the full mark for these types of answers, and the marks can actually range depending on how strict the tutors are. Also, if you are asked to list, remember I mentioned, state the most important items first, followed by the less common or less important items. And try to list vertically. You don't want the examiners to miss any points if you squeeze everything into one long sentence. After about 200 over scripts, it's very tiring for the examiner. For example, if the question is list 4 risk factors for atherosclerosis, it's not preferred for you to list them all like this. It's better if you just list them vertically. It's much easier to read for the examiner, and we are absolutely sure that you've given us 4 points. And same for you. You can be sure you've given us the requisite number. So some additional notes. Please try to keep calm. It may be difficult, I know. Skip your palpitation-inducing questions first. Come back to them later. Do remember that examiners are also human, and we have to mark hundreds of scripts, and we are prone to fatigue and boredom. So it's always better to help us and help yourselves at the same time. Make your answers as clear and concise as possible, and of course, always relevant. Organize your answers, provide headings, highlight key points, keep your sentences short and simple as far as possible. Now, just to recap, we looked at questions and we looked at answers. So very, very quickly for reading, 3 steps. You want to highlight the keywords. You want to make sure you read all parts of the question first. Check out the marks allocated for each subpart. In terms of interpreting, try to familiarize yourselves with the common terms that are being used, because this will give you a clue to the length of the answer. And now for the answers, where do you start? You want to always spend a few moments thinking and planning your answer out, and jot this down. Where to stop? Again, the best clues to tell you how long your answer should be would be in the question wording as well as the allocated marks. Now, how to organize your answer? For your long answers, make sure that it flows sequentially. Provide headings for your examiner so that it's easier to read. Just list vertically and put the most important or common items first. And I'll leave you with a few parting shots. Faculty do actually understand that studying is not easy. I mean, we were full-time students once, and I found this very cute equation on the net, student plus dying equals studying, and I do actually remember the days that it felt like this. Also, another quote for you, which I've already included in my studying tips section. Test ain't fair. Those that study have an unfair advantage. It's always been that way, and it will always be that way. So to put things into perspective, at the end of the day and at the end of your medical school, there is a patient waiting for you, or there are many patients waiting for you. Do it for him or for her. That's what we are studying for, so that we can help, we can make it better, and we can heal. So all the best. Happy learning.